In our last video segment, I gave you information that you probably didn't know about a disease that is so common in the black community, sickle cell anemia. Now I'm going to finish the job by telling you what the symptoms are and what you have to do if you have this horrible disease. The clinical course of sickle cell anemia is not the same in every person. Some patients have very mild symptoms and some have very severe symptoms. The basic problem, however, is the same. The sickled-shaped red blood cells tend to get stuck in narrow blood vessels, blocking the flow of blood. When you have sickle cell, you can get hand-foot syndrome. This is when small blood vessels in hands or feet are blocked, and pain and swelling can result, along with fever. This may be the first symptom of sickle cell in an infant. You can also have fatigue, paleness, and shortness of breath. There is usually also very severe chronic pain. This pain can occur unpredictably in any joint or organ. This can be debilitating and lead to hospitalization and dependence on narcotic medication. You can have eye problems and yellowing of the skin and eyes, which is also known as jaundice. Also, sickle cell patients have delayed growth in puberty in children and often a slight build in adults. The complications of sickle cell are very serious. In general, both children and adults with sickle cell anemia are more vulnerable to infections and have a harder time fighting them off. This is a result of spleen damage from sickled red cells. Infants and young children especially are susceptible to bacterial infections that can kill them in as little as 9 hours from the onset of fever. That's why sickle cell patients have to take antibiotics every day. Strokes are a huge issue in this disease as well. There's a syndrome called acute chest syndrome, which is similar to pneumonia and life-threatening, and it also is caused by infection or trapped sickle cells in the lung. It is characterized by chest pain, fever, and an abnormal chest x-ray. The diagnosis of sickle cell is made by simple blood test and is done at birth. This test is mandatory in most states in America. So how can you treat this sickle cell? I hate to still have to say that there is no cure for sickle cell anemia, but doctors can do a great deal to help patients, and treatment is actually constantly being improved. Basic treatment of painful crises relies heavily on pain-killing drugs and oral and intravenous fluids to reduce pain and prevent complications. Also, blood transfusions are common and decrease the anemia and prevent stroke. Daily antibiotics decrease infection, and folic acid supplementation helps to stabilize the red blood cells. Hydroxyurea, which is the first effective drug treatment for adults with severe sickle cell anemia, was reported in early 1995 and reduces the frequency of painful crises and acute chest syndrome. Patients taking the drug needed fewer blood transfusions, which is a great advance. Regular health maintenance is critical for people with sickle cell anemia. Proper nutrition, good hygiene, bed rest, and avoidance of all other stressors are important in maintaining good health and preventing complications. Many people with sickle cell anemia are in reasonably good health much of the time and live very productive lives. In fact, in the past 30 years, the life expectancy of people with sickle cell anemia has increased dramatically. So let's keep fighting so when I have to update this video in a few years, I can talk about a cure. I'm your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.